So on the subject of what you can do with your TRT rather than what your TRT can do for you, we talked a little bit briefly with Angela about exercise and mindfulness. And I wanted to introduce you to Guy, who also works for Eden Clinic in our health coaching program. So Guy, welcome.
Cheers, Felix.
And so why don't we start with telling us a little bit about how you got into this side of things in terms of health and coaching and strength and conditioning training?
Of course. So my background is strength and conditioning. Went to uni, then from there opened up a facility focusing mainly on personal training. From there, we kind of expanded and it became not just about the personal training aspect, it became about the holistic aspect. So
fantastic.
We work with people, we look at their nutrition, we look at what they're doing outside. And with Angela getting into this, it seemed, or with Angela sort of now opening the clinic and you guys coming together, it feels like the right step. As you discussed before, you get all the things and then are they doing what they can do outside? Well, not everyone knows what that is.
Yeah.
Some people do, they just want accountability. There might also be people who come to you that aren't necessarily going to get testosterone replacement therapy.
True.
For whatever levels they fall inside. But a lot of those people can sometimes really benefit from having someone to have a look at what they're doing, the other stuff. So the biggest thing that's a lot of times makes an effect for people that say they're overweight is having some nutritional accountability. Okay, that's cool. So we can look at that. The next thing very often is, how do you train? Well, some people go, well, I tried training, I tried this method, I got injured, I didn't like it. Okay, that's cool. Let's come up with a plan between us to see what suits you. Hopefully within that, we're going to get some cardiovascular stuff. We're going to get some strength stuff. We're going to get some mobility stuff, and we're going to work to see what can help you get the sort of gains that you could now find a lot easier to get, especially if you suddenly started on TRT. Yeah. So if you have been struggling and you suddenly get this, it's very much not a silver bullet, but you get this instrument that could hugely increase your energy, your motivation, that's brilliant. But now you've got to take it out of the box. As I hear you guys talk about, you want to use the tool that you've got the best you can. So that was a bit convoluted, but hopefully where I can come in is we can sit down, we'll go through a little questionnaire and we'll come up with some guidelines, some stuff we can be accountable on. So how's your sleep hygiene?
That's a big one, isn't it?
How's your nutrition? What training are you doing? Can we program for that? Because that's, again, stuff that I can look at. So it's hopefully just adding the holistic.
Yeah.
For what I know that term's thrown around so much.
It does go, doesn't it? But it's a dynamic that's definitely required, isn't it?
Yeah. Yeah. So hopefully just going through in a sort of normal conversation, first of all, with some pointers to go on. We're going to come up with a plan together. We're going to make some agreements on that. And then we're going to see how that goes. And it's as simple as that. There's no,
That sounds absolutely fantastic. And I think you touched on a few key points there. There's, you mentioned, and this will make anybody who weight trains or has weight trained for a long time laugh, you mentioned cardiovascular fitness as well. Mm-hmm. Now, it's something that some weightlifters can be quite guilty of, myself included in the past, not so much anymore as I get older. Mm-hmm. You get very focused on what you can lift or what those goals are or what your PBs could be. And we can be guilty of neglecting that cardiovascular side of things. Now, one thing we know about TRT is that it does improve cardiovascular outcomes. It's very much the opposite of what is touted in the more sort of sensationalist sort of media, where they talk about it causing heart attacks and strokes, when actually we've got multiple documented studies of evidence to the contrary. It actually improves cardiovascular health and will improve neurological health as we get older. So from your perspective, in terms of, because you very much look like a guy who practices what he preaches, if you don't mind me saying, so you clearly do look after yourself. In terms of the cardiovascular strategies that you might use, are you more of an advocate of a mixed kind of training model, so lifting and cardiovascular exercise, or do you get cardiovascular programming from the way you lift? And I'm thinking more along the lines of sort of CrossFit kind of style things. What kind of things can you do for patients from that point of view?
Yeah, so within talking about patients, what can we do that works for you? Like there's if someone tells you the only way you can do your cardio is sitting on a machine, that's going to put some people off.
Yeah.
So there's loads of ways you can get it. You can get it in walks. You can mix it within your type of circuit training. I like a lot of heart rate training.
Okay.
So I find it very easy, especially with broad brush for a lot of blokes who very often will push themselves, red line.
Yeah.
So being able to have that feedback mechanism of going, no, I want you to stay within this zone. And I find you can actually plug that into a lot of your training. So you can carry on your strength stuff or whatever you're doing. For me, it's jiu-jitsu as well.
Oh, fantastic, yeah.
And it's almost something that it doesn't take. If you can't, some people you can't add another strength session in, or you can't add another high intensity session in. They're tired, but you can back off a bit and still get some very good results using some lower steady state stuff, which sounds boring, but it's so important for health to take care of it some way or another.
It definitely. I mean, and the other thing that you know, people I think sometimes neglect, and I'm not sure what your views are, is increasing our NEAT or our non-exercise activity thermogenesis. So something that I'm a big fan of and that I often recommend to patients is that before they go downstairs and reach for the fridge or whatever they're having for breakfast, the cupboard where they get their cereals and things, you know, throw your clothes on and go for a walk around the block. Like that can be key, because it's, you know, there's that old analogy, isn't there, where if you move more, you move more, which sounds odd, doesn't it? But like it's so true, because you get yourself to a state, and it's hard for guys to see when they're at the beginning of their TRT journey, which is where guys like yourself are so valuable, I think, because you're there for that accountability and that motivation. It's hard for them to visualize that point at where their body craves exercise rather than really craving that next rest day, because that happens. Like for me, I think, you know, when I first started exercising years and years, I'm going back probably 20 years now, there was that moment when you first start lifting where that first 90 days is pretty hard and you constantly feel sore. And then you get to a point beyond that, if you keep the consistency and the regularity of your training for whatever situation you're in and your body type and your anthropometry, at a point where you suddenly aren't as sore anymore, and you are going, oh, what am I going to do next? And I think that's something that where someone like yourself, who's a personal trainer with a strength and conditioning background, comes in really, really well, because you can psychologically help those clients get through that point by going, I know it feels bad now, but we're going to get to a point where you feel better. And I think that's because I used personal trainers way back when I first started, and I used one as a lot of guys do, to get in shape for my wedding. And it was really the key difference, having that person there that was external and objective, saying, you know, when you think you're exercising hard, or your form's good, and someone's watching you and they're like, it's not that great. And there's only so many times I think you can video yourself with your phone and then look at your own form, or look at the effort, or that rate of perceived exertion that you think you have, and then someone like yourself will pull something out of you that you didn't know you had. And do you find that you get that with clients where they think they're training very hard, and they're actually, when they work with yourself, you find that they you know, have untapped depths that they weren't using before?
I mean, it's mixed. There's always the people who on their own can push themselves to crazy levels, but very often the people you're talking about are busy, have other things in life, and actually to motivate yourself to go to the gym and have the discipline to carry that on for a period of time is great. And then having some friendly forces in the gym to, again, check form, which is one of the first thing that goes when you're tired, and to give you a little push sometimes. That's as the role in the personal training. That's definitely what I do. Yeah,
I think certainly. And a key word that you touched on there was motivation, and I talk about this a lot with patients. I've actually mentioned it in previous podcasts with Dr. Andrew Wingay of Mad Medicine. Like and subscribe to his channel, very good guy. He and I talked about, and I talk to patients all the time about motivation being very useful, but a temporary tool. So then it becomes, for me anyway, more about routine and discipline. Because if you get up each day going, oh, I feel really good about hitting the gym this morning at 5 a.m. before work, that only lasts so long, doesn't it? Whereas when you build a routine, then that becomes part of your identity, and you say, this is what I do. I get up and I hit the attack bike or the assault bike. That's just what you do for the first 20 minutes of your morning. I think that becomes the key to breaking through where those motivational troughs occur. Because motivation, I don't know if you agree, it waxes and wanes, doesn't it?
Yeah, absolutely. And it's so often it's the thing that got you to take the step to get your bloods done by a clinic, to get in contact with a health coach, to get in contact with a PT. That's your high end of the motivation. But that will drop off. Life will give you a situation, just being life, where you're not motivated. But if you've formed a habit using that motivation and you've got the discipline to follow it through, that's the real thing you're looking for.
And that's key. And I think the other thing we've sort of briefly mentioned but not really expanded on is how important, I call this the triad of hormonal health, and that's what we eat is super important, and then the training. So be that, like you said, it doesn't have to be weight training, whatever you like doing that you will keep doing, and then hormonal health. Like it's, you know, because we can do the best nutrition in the world, we can do the best training with the best coach, but if our testosterone levels are low, we'll get some results, but nowhere near what we could get if we had optimal levels. So I think you know, having someone like yourself work alongside us as you know, the mere clinicians who help guys with the numbers and identify what needs to be done and looks at everything else in terms of their cardiovascular health, their other hormones like thyroid, insulin, things like that. Having someone like yourself with the expertise and background you have is just invaluable.
Yeah, and it fits nicely because you guys are the front line. They come in, they see you, they get the bloods done, and to be able to fit into that and go, okay, cool, when you speak to your doctor or when you speak to you, it's going to be, that's your conversation very often, but you're going to be able to now talk about what you've been doing. So I have been following this. Here's the plan I've been following. Yeah, I've now got my sleep hygiene in check. I've got a nutritional plan that I'm following most of the time. And I'm working on it. So to kind of be able to fit into that role is very much where I see this going. So
it's fantastic. Like, and you know, and I like what you said there. Like most of the time, because we're all human at the end of the day. You know, everyone has this idea that people, and I think this is largely social media influenced. People that have a good level of health and fitness are like drill sergeants. They're like, every day I'm doing the same calories, the same meals, and that just isn't the case. We're all human. We all have days where we eat things that perhaps we shouldn't eat, but as long as you're doing everything else right 80% of the time, you're still going to see results. And there's that saying that it's easier to maintain a good physique than it is to transform a bad one, and there is some truth to that. But I think we do need to allow for what life throws at us, like you mentioned, that life's going to give you a curveball or a situation where you go, do you know what, I really wouldn't mind a slice of pizza today, because it does give you that little, and it's okay to have those moments. But having someone in your corner like yourself that has that knowledge and training to be able to go, okay, we had a bit of a wobble, but this is the plan now. I think that's pivotal for some patients. Like you said, it's a spectrum, isn't it? You get some guys that come in that used to be, you know, top level competing athletes, and then they've become hypergonadal in their older age, and they know exactly what to do. They're like, I remember this, and now I feel like I can do it. But then the majority of our patients aren't like that. They're guys that need help from someone like yourself. So I think it's absolutely fantastic.
Yeah. Not loads more to add to that. I mean, you summed it up beautifully. I think the thing to add as well is you're taking people, patients, call them clients, we call them the PT industry, but that's a human that has struggled for whatever reason and is now hopefully going to move on to enjoying life a significant amount more. And that, for all the things, all the knowledge you guys have, for the stuff that is going to be plugged in, it's hopefully someone's going to live a happier, healthier life at the end of it.
And that's the goal completely, isn't it? Thanks so much, Guy. It's been great having you on.
Cheers, Felix.